My name is Amber Goldman, and my student identification number is 2634521, and this is my video for laboratory animals procedures. Regarding the first task of supervising or performing the feeding or watering healthcare of the rat, I'd just like to say that it's important to have fresh water available for them at all times. You also want to have a commercial rat chow, which is perfectly acceptable, along with any kind of treats, fresh fruits or vegetables that you want to supplement them for. You want to make sure that you have adequate sized housing for them. They're very social once they get used to you, so you can handle them. I wouldn't necessarily recommend keeping mixed sexes, males and females, together because they do reproduce very quickly. They have a short gestation period of just 22 days, and they can have up to 12 pups. So that number can get high real fast unless one of those are going to be altered, neutered. But he was really friendly, and I could see that him making a good pet. Following this, I'm going to go straight into restraint. My name's Amber. This is the unnamed rat. We've been calling him Templeton, maybe. I'm recognizing that he is a rat because he's bigger than mice. He's big. He's got a long tail, and also, when I bought him, he's a fancy mouse. So, handling him, I can choose to either pick him up by his tail close to his body, but he's actually very friendly and will just let me pick him up. I've been handling him a lot. So we'll just let him rest in my arm. Again, if I need to hold him by his tail, hold it close to his body, but not for long. And we'll just put him back in here because this is where he's comfortable. So I'm going to pick up my rat now. Again, whoops, I'm stuck. He's very handleable, so I'm just going to hold him. I'm going to put this on the ground now. It's out of the way. And the way that we're going to recognize that he is a male is, for one, because he has these huge testicles down here, but also knowing that the anogenital distance for males and females is much longer for a male than a female. So he's very obviously a male. And they do have open inguinal canals, so if he were upset enough, he could pull those gonads back up into his body. So next, on that, we're going to perform a physical exam, and he's getting rowdy. So while he was in his room in there, you want to watch for just the way that he's moving, any kind of ataxia. Going to look for any head tilt, that his eyes have any kind of discharge. We'll also want to look for hair loss, because while he was at the pet store, there might have been any kind of fighting or the barbering where the other rats may be picking on him. Also want to examine his stomach, gently squeezing it for any kind of masses, tenderness. Want to examine all of his feet, his digits, making sure that nothing seems painful. He just seems anxious. While he's comfortable in his room also is when we'll be able to examine his respirations, that he's breathing comfortably, because once he's in our hands, it's just too difficult to assess that. And listening to his heart as well. Their heartbeats are too fast for me to count and assess. With restraining him, I can restrain him like this, and he is very handleable like this, or I can put him down on the table. Hey, take it easy. I'm gonna push him down. Oh, hey. Alright, so we're going to reconvene in just a moment. We're going to recollect ourselves. So we're going to try attempt number 2 to do the sub-Q injection. So I'm going to use the heel of my hand to press him to the table. Go ahead, lay down. He's on to my games now. So I'm going to try and work rapidly. Tint the skin. Got a smaller syringe here. We got the little oh, sucker.
And
We got the little bitty insulin syringes. I'm tinting the skin. Oh God. Alright, turn that off.
I just don't want him to bite you. Or you want me to? There we go.
Can you get to a sub-Q area?
Mm-hmm.
You got it
Do
going?
ya?
Mm-hmm.
Look, he's looking at me. I
So
know.
he is very not appreciating the restraint. So I've got him burritoed here. I'm pressing him against the table. Fairly is going to carefully scruff him and tint the skin to inject the needle for a subcute injection of LRS. And go ahead, pull back a little bit, aspirate. We see no blood, so it's good to give, and that's enough. Success. I'll show you how to do the IP injection, and as we've seen with the sub-Q, our rat here does not like being handled. He's also very scared at this point, so I'm having to use 2 hands as opposed to the way our video is demonstrating, and Fairly is going to be the one injecting. So I'm holding him downwards to get his intestines out of the way, and then I'm also pressing him against my body. She's going to inject and then aspirate to make sure that nothing comes back. And there's no color change, so we're good. And then she's just going to push the fluid in there. All right, and that's all. I'm going to demonstrate oral dosing now. So the first thing I'm going to want to do is measure on my red rubber catheter because we do not have those dosing syringes here. So I'm going to measure down to his last rib, which is actually right about there. Yeah. So that's how far I'm going to insert this into his stomach. And then if you'd like to burrito him back up, we should just be able to put this.
I know you're angry. I know you're angry. I know. I know you're angry. Tell me all about it, right? Tell me all about it. I'm sorry.
That's okay.
I can get his little.
Okay. I'm just going to slide this in the side of his mouth. The dangerous thing with the red rubbers is that he can chew on it. So we'll want to really keep it out of his teeth and just go down the side of his mouth. And it is feeding very easily. Don't chew it.
No. It's okay.
And it's feeding very easily, so I know I'm not going into I'm going into the right area. And at this point,
Great.
I would just insert the
Here, you want me to?
Yeah, keep that on the side there.
Stop.
And I would put this in there and inject. Now I'm going to easily slide this out.
Nice job.
And that would be that.
Nice job. Go ahead.
Alright, so we're going to attempt a venipuncture here. We are going to try the lateral vein. You can choose from the caudal artery or the lateral vein, and I do see a very faint blue line there. So that is going to be my goal. I actually lost it. This tail is really cold. Double up. Boy, these tails are hard.
It's tough skin.
Boy, I sure do not see how this is something possible.
Looks like you should be in the right area.
Mm-hmm.
It's hard to tell if you need to go deeper.
Yep. Man. Well, I don't see a blub of blood, so I certainly didn't hit anything. You can pause it. This is my mouse's house while he's living at my house. It's got an open cage so that he can breathe and air out. We can also put him in a fish tank. We've been debating about that. And you can see that he's got fresh water in his room there, and he's also got shaved paper, shredded paper, which works for him. He's enjoying a little Cheerio right now because he's had a rough day at the vet. We had to catch him with a towel to give him some oral administration, and then after that he was so stressed out we gave him a rest, and then we decided to sedate him to do the injections. But it's important that I'll keep him with fresh water. I'm not sure if I'm going to keep the bedding in there. I may choose to switch to Alpine Chips because the veterinarian said that that's a good deodorizing bedding. And he's got one of his little berry balls there and some apple and cheese. But he recovered really well today, and he's happy and healthy. Okay, so our little mouse is coming out of anesthesia here. We had him sedated to do the injections. I've got him on 0.5, even below that flow by. I'm going to go ahead and turn him off and take him out. I can see that he's breathing. I was watching that the whole time, and he is nice and pink there. I can tell that he's a boy because of that anogenital distance that is so much longer for females and males are so much longer than females. And you can also see his bulbous gonads there. I can see that his heart is just pounding. His eyes look nice and clear. And I've got him holding him by a scruff. He will bite me, so I'm going to just move quickly and see that he is well. Once we put him down, I'll watch and make sure that he's walking around nicely, which he seems to be recovered just fine. That's another part of doing the exam, is really just watching how they're moving around in their cage. If they're dizzy, which he might have a little bit of that right now coming out of recovery, but I had him so light, I think he's good. If I need to pick him up again, I might have a good chance right now. Doesn't look like it, but I'll try. Grab him by his tail. Or, you know what I had to do the first time, since I need to do this for the video, is catch him with the towel. And then, gosh, he's such a quick one. All right, we're not going to get him. Okay, so I have, this mouse is very, very rowdy. We've had a very difficult time managing him, so I've got him on a little flow by, and I'm going to do a sub-Q injection here. Pull back. He is breathing. I can see him twitching just a little bit, so I'm not just want to act very quickly and get this done so I can wake him up. Now we're going to do this IV injection, so I'm going to pull his skin up just a little bit so I can go all the way into his abdomen. I'm going to pull back. Do not see any brown or yellow fluid, and I'm going to push that in. Okay. In the following segment, I just want to clarify that I'm at For Pet's Sake, which is an exotic veterinarian down the street from where I currently work, and their nurses, their technicians, were assisting me learning how to handle my mouse. So one of them actually is restraining for me, and one of the other nurses is videotaping while I'm actually administering the oral medication, which was really just water in this situation, and this is how they do it in their clinic. Okay.
Jeff, your film ready?
It's going.
Just water.
The final portion of the video, which is the rabbit. And again, this was not my rabbit, so I cannot speak to supervising the way that it was fed or the healthcare at home. But just like anything else, they need fresh water at all times, and they are vegetarians. They're also coprophagic, so you might witness some of that. You can, along with their commercial food, you can supplement it with treats out of anything that you might grow in a garden: cabbage, broccoli, carrots. You'll also want to assist with and be aware of hairballs. pineapple or papaya can help with that, and you want to use the treats and the fruits sparingly. It can also upset their stomach. They do prefer cooler temperatures as opposed to the other rodents. They are subject to overheating and temperatures that get above 80 degrees. And they also reproduce at very high rates. So mixed populations can get extremely large. It's best to keep them separate or neutered. And the gestation period is just around a month, and they do also have up to 12 babies. You have to get me in the video though. My name's Amber. This is Baggins. He is a 3-year-old Flemish giant, and he's my subject for the day. So I'm going to, if I were to restrain him for the doctor, I'd hold him close to my body, put one hand behind his head firmly and behind his rump, and I'd hold him like this. Or if I need to pick him up, it's important to support his back end, so I'll put both hands underneath him because he's way too big to scruff, like a football. Lean up and back like this. And this is how I would hold him for as much as I can for the doctor to examine. Okay, you can cut. Alright, so this is Baggins. This is Aubrey, Baggins' mom. I'm going to do gentle pressure back here and extrude his penis, proving that Baggins is in fact a male, and can actually feel his little scrotum down here too. Alright, great job Baggins, thanks. I'm going to perform a physical exam on Baggins now. So the first thing I'm going to do is just look at his overall body and feel for his body condition score. He feels very healthy, feel a belly. I can feel his spine here. I'm going to look inside of his ears. They look nice and clean. Look at his eyes for any kind of tearing. Look for a head tilt. I don't see anything. I'm going to feel his belly for any tenderness that he might have or any masses. I don't feel anything. Then I'm going to ask Mom if she will please pick Baggins up. And here I'll just feel his legs, see if there's anything painful. Can take a look at his nails. Same thing, and his joints, looking good. I already examined his genitalia, so we know that he's looking good down there. Feel his arms here. Looking good. One more time. I don't see a head tilt either, so. Alright, if you'll put him down. I'm going to listen to his heart now, and lungs. Doing great, Baggins. Very fast heart rate. Sounds very normal. Alright. Seems like an overall healthy rabbit to me. Alright, so I'm going to demonstrate how to give Baggins some oral medication now. So I'm going to just have a 0.2 mils of water here, and I'll just shoot it into his mouth. And he swallowed it down. And that's that. I'm going to demonstrate now how to give a sub-Q injection. I've got 0.1 mils of LRS here, and I'm going to reach behind his ears to where his scruff is and tint the skin. And Mom is going to keep him comfortable for me. And then I got a new needle, and it's a 25 gauge, so it's small. Feel between his skin. And I'm just going to go fast. Aspirate back, make sure that we don't get any blood, which I don't, and then I'm just going to push it in, and that's it. So I'll look, I don't feel any wetness, so I didn't go through, and that's how you do a sub-Q injection. Demonstrate how to clean Baggins' ears now. His ears are really clean, so there's not too much I'm going to need to do, but if they were dirty, the first thing that I would do is take a Q-tip just to clean out the visible debris, but I mean, look at that, it's beautiful. His mom and he do a great job keeping that clean. And then once I used a Q-tip to just go around the outside where you can see, I take a cotton ball and wipe it out as well. And that's all I would do to clean his ears. Now if I was going to get an ear cytology, We go ahead and pause it. If Baggins had an ear infection after the ear has been cleaned, which I did previously, I would take some ear drops, his prescribed medication, open his ear canal up, and gently pull it up just a little bit, and then I would drop the ear drops. Let's see what yeah. Put that down in his ear, squeeze a few drops in there, and then massage it around. And that would be, if it was red, if his pinna was red anywhere around, I might also rub that around there. But otherwise, we would just drop the drops in there. That's it. Right, how to obtain an ear cytology. Take a Q-tip, put it right down into his ear, and twist it around. You don't want to go too deep. You'll damage their eardrum. And then you slide. This is the right side. So you just roll it out on the slide. And I'll take a look at this back there. I'll do the same thing for his left ear, making sure to break the Q-tip and mark on my slide that it's going to be on the left side. Okay, you can stop. I just stained the ear cytology that I got from Baggins, and I'm about to look at it under the microscope. I'm going to set up my camera and then get back. Alright, I'm looking at the ear cytology for Baggins, and you should prepare it based on what the sample looks like. And Baggins, if there had been a lot of really dark debris, I would have just looked at a straight slide for mites under low magnification. This one, but his ears were really clean, so I just took a little bit of debris from deep in his ear, and I smeared it and stained it, and now I'm looking at that, and all I see are some skin cells and the most rare, I've seen maybe 1 or 2 yeast organisms, which isn't surprising. So I would say that Baggins has healthy ears, which correlates with the exam yesterday. Very clean ears, no redness. So I wasn't able to obtain a blood sample on my first stick, but his vein is still completely intact. I didn't blow it. I just got a new needle. Instead of the butterfly, I'm going to do a 25 gauge needle. I'm going to ask Aubrey to please hold the vein off again. Let's give it another little squirt of alcohol there. I'm going to stay so shallow. Oh, I got a little flash there. Oh, and he's blowing. You want to turn your syringe a little bit, and there we go. We've got some blood coming. Nice, bright red blood. And we're going to hold off, remove the needle, and I'm going to hold that off for a little bit. I can also put a piece of gauze there with a paper clip if I needed to do something with that blood sample quickly, but I'm just going to sit here and hold his ear off. Thanks.